Just one mistake of doctor wasted my entire 1 month effort for bypass surgery preparation at Safdarjung Hospital. From blood accumulation to getting different tests done, running doctor to doctor, department to department for whole preparation, and at the end of the day, doctor said this patient cannot be operated. That means he needs to be put on the medicine, and my effort was wasted completely. With this video, I am not trying to criticize the hospital or doctors, but I am trying to raise the awareness level that how I suffered should not be suffered by somebody else. The story begins like this. With the heavy chest pain, I rushed to the Safdarjung Hospital for treatment. Their doctor prescribed angiography. Next day, he got admitted for an angiography. Angiography was done, and post that he got complication in his heart, so much so that he was admitted in the ICU. At a very first checkup, doctor said that this patient has to be operated for bypass surgery or angioplastic. Either you can go for bypass surgery or angioplastic. We considered on that, took few moment, and decided that since he has 90% of blockage in which angioplastic will not be effective, so let's go for bypass surgery. Doctor watched that CD which we get after angiography, and doctor very clearly said that this is the remedy or this is the last resort we have for this patient. He needs to go through this surgery as soon as possible. Surgery doctor saw, cardiologist saw, and everything happened in that ICU. He was getting all the tests done by me. I was running from inside to outside, department to department to get one clearance to other clearance, like sugar clearance, then kidney function, dialysis clearance, and everything I was getting done. And one report got stuck, that was PAC, and that stands for pre anesthetic checkup, and that test is all about checking the condition of the patient, whether a patient is ready for the surgery or not. Means the capacity or the capability of the patient is checked in that PSC report. And for that report I was running multiple time for that, but since it was getting delayed, the ICU doctor said that we cannot keep the patient inside for preparing for the surgery. We have to discharge because we have to be we have to clear the bed. We requested, but at the end we had to rely on the doctor's suggestion. So we got discharged, we came back home, and we started going again to CTVS doctor, which is a department of surgery for the further proceedings. Also we were reviewing our PSC. So one side PSC was being reviewed, and on the other side CTVS doctors, who is a surgery doctor, was checking the condition of the patient for the surgery. Everything was going smooth towards the direction of surgery. The CTVS doctor, surgery doctor, said that this patient needs to be like this patient blood level or hemoglobin level is low, so he needs to be raised above 10. So we went to the emergency, and first time they denied to transfuse the blood, and then again second time we went, and that first time second time is a totally a multiple visit, and that's a different story what had happened in that emergency. On one bed there were 2 patients sitting and were being treated, but somehow we managed to get that blood transfused, and he was having the hemoglobin above 10, so it was cleared there. Then again we went to the CTVS doctors, and so he said that let the PSC report gets done, and for that, and that's the biggest report by the way, so for that we had to make almost 5 to 6 visits, because in that report everything is checked, from your diet to your sleeping pattern, any pain in your body, everything gets checked in that report. And doctor at the end of the day clarified that this patient can be operated. So we got the clearance of the POC, that means they admitted from their end. Now they said that go to the CTVS doctor, get the surgery date, and then we will proceed further. Again I went to the CTVS doctor. They are now saying that you need to have 6 unit blood before we give the date. So I did not have that much card. Card means one card is like 1 unit of blood. So again I had only 2 cards. So they said that at least I need 5 cards in order to give you surgery date. Getting blood or asking someone to donate blood is much difficult task. I know that near and dear can do this, but asking someone who is unknown or maybe who is friend is little difficult, I would say. So I posted on my WhatsApp status, but fortunately I am very thankful for those guys came forward to donate the blood, and 3 guys donated the blood. So I got 5 cards, and I had also called my relative from Bihar. They came all the way from Bihar to donate blood, and they donated 4 units. So from those 4 units, 2 were in transfused and 2 were remaining. So 2 and 3 became 5 cards for surgery date. So I was completely ready. I was I was little happy that today I am going to get the surgery date with all the reports, with all the efforts. And when I went to the doctor, see what happened. Doctor is saying that this patient cannot be operated because the CD says the patient condition is non-graftable, like the angiography report is non-graftable. I don't know the medical term, but they said that from where we have to attach the nerve, it cannot be attached there to the destination place, like bypass surgery, when we have to connect from one place to another. So this cannot be done to the patient. It was like this was not problem to hear that, but the shocking part was that after 1 month of effort, we are listening that this patient cannot be operated. Seriously, means after putting all the effort for surgery, going here to there for different reports, for different department to get clearance, and now doctor is saying that this patient cannot be operated. What was the need of this 1 month rush? I had to make multiple visits to the hospital. More than 20 times I have gone to that hospital in Safdarjung. And what I am coming to know is that my effort got no meaning. It was wasteful, because now he is going to be put on medicine which could have been done at a very early stage. What was the need of these reports and these hassles? So here question arises that being a non-medical guy who does not know much about the medical terms, how can we rely on those doctors who are saying to have these tests done, those tests done, and at the end of the day they are saying that this test has got no meaning because he cannot be operated, he will be put on medicine. This was the very strange and I would say that very pathetic experience in that hospital. Not the entire doctors of that hospital is bad, because they helped me, but I would say that some were very negligent, unprofessional. The way they took this patient in their consideration was not professional, was not serious, because how can they decide the surgery and later they can deny? This is not acceptable, this is not meaningful. So my learning was that we have to have the second opinion from the doctors. before we conclude for any bigger conclusion, seeing the condition of the doctors and hospitals in India, like much crowded. Doctors may have pressure, but doctor have to see the patient very carefully to avoid such hassle, to avoid such life-threatening disease where the patient can die if he or she does not get treatment on the time. So that's the biggest learning I got from this hospital. What's your opinion, where I did the mistake? Like you can imagine that I took several leave from my office, several relatives came from Bihar, and staying here, managing them, doing everything was not possible, and it was not required at all if doctor wanted to write the or prescribe the medicine, because I was enough to go 1 day or 2 days or 3 days to get that medicine written on the paper, but doctor did that. So that's my feeling for that hospital, Safdarjung. Again I am saying that I am not at all criticizing the hospital and doctors, but I am just raising the awareness that this is what happened with me, and could happen with you as well. So be aware about that, be alert about that, be cautious about that. Alright, so I think that's it from my side. Thank you. This is Piyush signing out until we meet again.